Hope you're enjoying this discussion. If you want me to post videos on any specific topics, you can put it in the comment below. So today's question is 40-year-old female presented with dysphagia, thickening of the skin and cutaneous ulcer. What is the serological investigation which can help in the diagnosis of this condition? So remember, it's a middle-aged female who is having dysphagia. That means some esophageal disorder along with thickening of the skin, dermatological manifestation, and cutaneous ulcers. Cutaneous ulcer can develop due to various causes. It could be due to ischemia also. So there is some vascular damage. So putting all together, you have dermatological plus visceral involvement like dysphagia. So this diagnosis, especially in a female, it points to a autoimmune condition. So any guess what is this? So this is called systemic sclerosis or Scleroderma. So scleroderma is an autoimmune disease in which you have fibrosis of different organs and vascular damage. So only because of this vascular damage you are getting cutaneous ulcers. Okay. So what happens in systemic sclerosis is you have thickening of the skin because of all these fibrosis. Your mouth becomes small. So this is called microstomia. Okay. And in scleroderma, you have two types, diffuse scleroderma and limited. Diffuse means you have involvement of skin and other viscera. It could be any viscera, you can have involvement of esophagus or other organs. Limited means it's usually confined to the skin of your hands, forearm and the face. Okay. So diffuse type of scleroderma is characterized by anti-topoisomerase 1 antibody or anti-SCL70 antibody, whereas limited type is characterized by anti-centromere antibody. So the mnemonic is, you can remember as LC, limited anti-centromere antibody. Okay. So what about the other types of antibodies? So the diagnosis here is systemic sclerosis, which is diffuse type. So your answer is anti-SCL70. So now look at this option. Where do you get anti-U1 ribonucleoprotein antibody? This is seen in case of mixed connective tissue disorder. When you have a feature of one or more connective tissue disorder, we call it a mixed connective tissue disorder. What about anti-gliadin and anti-endomysial antibody? So remember, you have a disease called celiac disease, wherein you have sensitivity when you consume foods containing gluten, which is a protein, gliadin containing protein. So you have a lot of antibodies in this condition. You can remember the mnemonic GET. So anti-gliadin, anti-endomysial and anti-tissue transglutaminase antibody. So GET is the mnemonic which you see in celiac disease. Whereas Crohn's disease is an inflammatory bowel disease, wherein you see anti-Saccharomyces cerevisiae antibody. Okay. Thank you.